Good afternoon. I'm glad to see you again. You've mentioned that you've been feeling anxious about work and have some concerns about your colleagues and supervisor. I understand that these thoughts and feelings can be quite overwhelming. I appreciate your openness in sharing this. Is it okay if we explore this a little further using cognitive behavioral therapy techniques? Let's take some time to explore these thoughts and feelings more deeply. You mentioned an incident where you walked into a room and your coworkers suddenly stopped talking. You thought they were talking about you. It's understandable that you might interpret the situation this way. However, let's consider other possibilities. Could they have been discussing a private matter that wasn't about you, or could they have been planning a surprise?
Maybe, but it's hard to think like that when I feel so certain.
I can see how those situations could make you feel uncomfortable. Now, let's try to evaluate these thoughts. Here's where cognitive restructuring comes into play, a fundamental aspect of CBT. It allows us to challenge the validity of our automatic thoughts. Let's take the thought about your coworkers talking about you. Are there alternative explanations? Could they be discussing something else unrelated to you?
Well, I suppose they could be, but I often feel they're talking about me.
That's completely understandable. It can be challenging to question our automatic thoughts. But remember, our goal here is not to convince you that your thoughts are wrong. Instead, we're trying to consider alternative explanations and to understand how these automatic thoughts might be influencing your feelings of anxiety. Let's move on to the next example. You mentioned that you feel your supervisor doesn't like you because she often looks serious when interacting with you. Again, it's possible to interpret it that way, but could there be other explanations? Maybe your supervisor had a tough day or is generally serious by nature. Could these possibilities also be true?
I suppose so, but it doesn't stop the thought from popping up in my head.
It's normal to have these thoughts, especially when we're anxious. That's why the next step in our process is crucial. Learning how to manage these thoughts when they do pop up. Let's work on some strategies to help you challenge these thoughts and consider other perspectives. This is not to invalidate your feelings but to provide you with more coping tools. A strategy we can use is cognitive reframing. This involves consciously choosing to interpret an ambiguous situation in a less threatening way. For example, when you see your colleagues talking and they suddenly stop as you enter, you could reframe the thought from, "They must be talking about me," to, "They might be discussing something private that's unrelated to me." As for your interactions with your supervisor, you could reframe the thought from, "She looks serious, she must dislike me," to, "She might just have a serious demeanor, or she could be dealing with her stressors." These reframing exercises can take time and practice but can significantly reduce your anxiety over time. How does this sound to you?
It sounds challenging, but I think it could be helpful.
It can indeed be challenging, especially in the beginning. But remember, it's a skill. Like any other skill, it will improve with practice. For the coming week, try to practice this cognitive reframing consciously. When an automatic thought arises, pause for a moment. Challenge the thought, and try to reframe it. We can review your progress in our next session. Does this sound like a plan?
Remember, real-life therapy sessions can be more complex and require continuous adjustments according to the patient's responses and progress. Always consult a mental health professional for proper diagnosis and treatment. As a disclaimer, the information in this video is meant to provide general awareness and should not be used as a substitute for professional medical advice or therapy.
Thank you so much for joining me today. If you found this video helpful, please hit the like button and share it with your loved ones. Subscribe for more content on mental health awareness.